So Turner, thank you for joining us. We have a couple of questions here. What are the possible side effects? What percentage of patients experience side effects?
Yeah, thanks, Mark. Yeah, no, we went over some of those in the presentation, but just to break down and get into that a little more, really the main side effects that we see most commonly are GI related side effects. Nausea, diarrhea, constipation, vomiting are the most common of those. Uh, and that really occurs more often when you first start the medication. So those starter doses, the first month or two, really is where we see most of the nausea and potentially vomiting for patients. Women, unfortunately, are more susceptible to the side effects. It seems like they do get side effects at about twice the rate of men using the medication. But overall, the percentage about probably half of the people that start the medication will get mild side effects again. And when I say mild, that's mild nausea, mild, GI issues. Less common are the more, vomiting is about 25% of people that we use it may vomit once or twice. And again, when we talk about these side effects, these aren't, every day, or it just occurs maybe once or twice. And usually that occurs if too much food is eaten, or a large meal is eaten while when you first start the medication. After month 3 or 4 or 5, really we start to see those side effects taper off to much lower rates once your body adjusts to the new way your stomach is functioning, essentially. So that delayed gastric emptying, that the slower food processing that also makes you feel full, can also give you more side effects if you eat a large meal or something like that. So that's typically what we see. We've had very few patients stop because of stop using the medication because of side effects, but it can occur. We have had some over the time period that could not tolerate it, but it is unusual. So
Well, and we're going to say this quite a few times, but really your dosing can be your poison. It's key that when you first start this thing, that you pay attention to what you eat, because that's really important. And then also, it don't take too much too quickly. I know there's a recommended dose, but you're in control of how much you take. And I think that's very important to let your body adjust to this particular weight loss program, as opposed to trying to force it to take. Because when you start seeing it work right up front, you get excited and you want to try to take more. You got to be cool. You got to just let your body and the medicine really work together. That's
that,
it.
that's exactly right. The rate of side effects are much higher if you start at a higher dose. There's no doubt about that.
Sure, sure. Let's go to the next question. In 2017, I had a gastric sleeve surgery. Can I try semaglutide weight loss products? I can no longer take NSAIDs.
Yes, the semaglutide is safe with both gastric bypass and lap band surgeries. It's often prescribed now in conjunction with those to basically further assist the weight loss once the post surgery for that, and maintain the weight loss post surgery. So yeah, no, there's no contraindication there, and in some cases, it's actually a recommended add-on therapy.
Right. Good. Next question is, does oral application work differently than injection? Is the dose increase over time? If you stop, do you need to taper?
It does. Oral application does work differently. These types of molecules, these peptides, are very sensitive to stomach acid and breakdown in the GI tract. So that's why the injection is unfortunately necessary for the most part. The uh, Pretty much every major drug company out there is working on an oral formulation for these products. If I'm trying to figure out a way to protect those molecules in GI tract, because obviously, tablets are much easier to use than injections. There are some online pharmacies out there that are offering compounded oral medications. Those have not, honestly, just have not been studied much. So the efficacy of those is just not really proven. Um, so it's hard to say if those are effective or not. I would think sublingual tablets, or tablets that dissolve under their tongue, may offer some benefit, as you could get absorption through the oral tissue without getting through to the GI tract. But again, those really haven't been studied very much, so it's hard to talk with any confidence about how effective those are.
Sure.
Um, the,
And I think the reason that you went to injections is because you knew that they work,
Right,
Where I think a
exactly,
lot of the
exactly.
oral is still, it's still being tested.
Exactly, exactly. It's um, there's just I've always had problems offering something that I wasn't sure was going to work. So that's why the injections are pretty much are proven for sure. Um, is the dose increased over time? Yes, like we mentioned in the presentation, it is over a 5 to 6 month period, increase to the maintenance dose. If you stop, you need to taper. No, you can stop. Your body will readjust. Go back to baseline. There are really no side effects. From stopping the medication cold turkey there. So that is something your body will just kind of return to baseline on. So
Sure. And I think some people have a goal for weight loss, and if they reach their goal before the end of the 4 or 6 months that they've allocated for this, you can stop and go back in that maintenance mode.
yeah, no doubt. Yeah, exactly. That's exactly right.
Right. You don't have to run it to the end if you've reached your weight loss goal.
That's
Um,
exactly right. Yeah.
Next question is there really such a thing as weight loss while using cannabis? I struggle with that. As a cannabis practitioner, I can tell you cannabis is not the right way to go if you want to try to lose weight. There are terpenes that do have weight loss as part of their effect, but they are not in the same league as this particular medication. They will maybe help cut down your cravings. They'll maybe help you not be as full, but cannabis isn't the solution to weight loss. Um, this is the type of program that is. That's one of the reasons why, as medical marijuana and wellness providers of information, we put on this webinar. Your thoughts on that? Your thoughts on that, Turner?
No, for the most part, that's absolutely true. There's been some talk recently about THCV as in Victor, which is one of the cannabinoid sort of derivatives that people are experimenting with that may have some, that may help to mitigate that appetite stimulation of the THC a little bit. But as a standalone, yeah, it would definitely not be a first line treatment. It would be something that if you were really prone, if you're a medical cannabis user and you're really prone to having a lot of appetite stimulation, it may be something to look at a formulation with a little bit more of that THCV or an add-on from one of the CBD shops that has those formulations in there. But yeah, I agree with you. As a standalone weight loss product, that probably wouldn't be the way to go.
Yeah, I mean, THCV will help you cut down on, let's just say, it will help you cut down on your desire to eat,
Right.
but it is
Exactly.
not a weight loss program. It just
No,
cuts down to
absolutely.
get down on your diet. And to be candid with you, I'm not run into in the cannabis world. I've not run into a lot of studies that have really conclusively said that this is something that's a weight
No,
loss.
I agree. It's been more of a recent buzz around it, but I couldn't attest to how effective any of that is. Yeah.
Right. And I think that I'd rather go with a program that's proven with, years of studies and that are
Yeah,
out there
exactly.
rather than
Exactly.
something that just is the current trend in cannabis. Let's put it that way
Exactly. Exactly.
out there. Cool. Let's jump to the next set of questions. Is there a CBD dominant strain of cannabis for weight loss? Do you want to crack that one, Turner, or do you want me to take it?
You can take that. No, that's fine.
Okay. There is a humulene is known to help with it's a terpene, okay, and it's known to help with let's just say your desire to eat or your desire to crave food. Um, the question is there a CBD dominant strain? And that depends on the various strains that are out there. Really looking at the various strains that are there. The only one that I found that has humulene that is CBD dominant is called ACDC. But again, I would use that and understand. I'm answering your question directly. It does have humulene in it. It does help with CBD, but I wouldn't use it as a weight loss program. It does cut down your cravings, but it's not going to cause you to have dramatic weight loss like you're seeing with semaglutide. Your thoughts, Turner?
No, I agree. No, I think it's very similar to what we just discussed there for sure.
Sure, exactly. One of the questions is it only available to Florida residents like medical marijuana is?
Yeah, so our practitioners currently we are just have Florida licensed practitioners, so they are only allowed to prescribe in the state of Florida to Florida. It doesn't necessarily have to be a Florida resident, but the patient does have to be in Florida to for the provider to prescribe it. Yes.
Sure. Now you don't need a medical marijuana card. And in other
No,
words, you
there's
don't need
no
a
there's
card
no
for it.
card. No,
Medical
this is
marijuana
a
requires you to have a card. This doesn't require you
no,
to have a
exactly.
card.
This is just a standard medical treatment, and it's available via telemedicine. So again, anywhere in the state of Florida, is available.
Sure. But again, this particular program is only licensed for people that are Florida residents.
Physically, well, the people that are physically in the state of Florida, they don't have to necessarily be residents, but they
Okay.
have to be physically in the state. Yeah.
All right. That's cool. That's good. Um, each person from your office now licensed to administer GLP-1, or is there a specific office I have to go to?
No, yeah. So again, it's a telemedicine program. So really, anywhere in the state of Florida, you can access this online. Now, if you do prefer to be in person, there are the four specific offices that we mentioned in the presentation that are you can actually walk in and get that service provided to you there.
Mhm.
But otherwise, if you're not close to one of those offices or it's not convenient, then we offer the online telemedicine and coaching for the full program.
Sure. Next question is, next question is, uh, can this be taken as a replacement for metformin, 500 milligrams?
Yeah, no, Ozempic's really not intended as a first line diabetic treatment. So it's more of an adjunctive therapy that is added on to other types of therapies. Metformin is certainly a first line treatment, and that's a pretty standard medication for most type 2 diabetics. And so, yeah, it would probably not be a replacement. It would just be something that basically as an add-on to help control the blood sugar spikes that may occur with type 2 diabetes. And again, for most patients that were being treated for type 2 diabetes, that's something your primary care physician would want to you should probably talk to them about rather than just using a weight loss specific program. So they have the whole picture there.
Sure. Good question. What is the maximum BMI for those with back issues to obtain semaglutide? I don't think there's a limit on BMI, is there?
And there's not a top end limit. Again, you have to have a minimum limit of 27 to qualify for to use a semaglutide as a treatment for weight loss. But yeah, there is no top end limit.
Hmm. Yeah, good, good. Yeah, I think that's like you mentioned, you have to have a BMI of 27 or above, but really, it's really helped a lot of folks with weight loss programs.
Absolutely,
Uh,
absolutely.
let's go to live questions that were asked during the webinar. Um, Andy asked, are there any known side effects when food is slow to empty from the stomach?
That's when we see those GI side effects, the nausea and occasionally the vomiting can occur, and heartburn as well. If you eat, and again, this typically occurs if you eat fatty meal or a meal, a large quantity of food, because it does sit on your stomach longer, and until your body adjusts to that, uh, you can get those GI side effects that are a little more than you would ordinarily have with a similar size meal. So yeah, that's really what we see with that. A little more nausea, a little more indigestion with that.
Great. Tracy asked the question, is the medication covered by medical insurance? I think depends on your medical insurance company, right?
It absolutely does. Yeah, there are. It varies widely from insurance type to insurance type. So it would just be to check with your individual provider or carrier and see if it's a covered service or not. For the most part, most commercial plans do not cover weight loss medications. Some of the state plans do, but that's not a universal rule. So it would just be you would have to check with your individual insurance to see if that's a covered service or not.
Yeah, and I think you'd work with the individual to figure out if that's covered or not, right?
No, exactly. And yeah, and really our service is more intended for those patients who don't have insurance coverage to make it affordable, essentially. So
Cool. Great. Tracy asked a question, is there a grace period that you must be free from other weight loss pill products you can have consumed before you begin the program or this program?
no, not in particular, unless you've been taking another GLP-1 agonist. But even then, you could switch from one to the other pretty seamlessly. So no, there's really not any other. It worked. It's got a very novel. It doesn't work the same way as really any other weight loss product on the market. uh, other than other GLP-1 agonists. So, as far as interacting with other medications or interacting with the same type of effect, you really won't see that with other medications.
Sure. Next question is, anonymous asked, telemedicine is only available in Florida. Why wouldn't it be available in any state if you're never going in person?
Well, yeah, that's the way state medical boards work. Doctors have to be licensed in the state they practice in. So if a doctor is not licensed, now if a doctor has a license in all 50 states, then absolutely. But it depends on, again, the doctor, we started out just offering it to our medical cannabis patients mainly at this point. Although anybody can use it, but most of our providers are licensed only in Florida. We do have some with surrounding state licenses, but for the most part, again, unless a doctor has a license in a particular state, you can't prescribe even via telemedicine, because again, they're prescribing to a patient that lives in that state. So
Yeah, and I think this is important to point out. You're trying to put together, in fact, you have put together a safe semaglutide program where the individual on this particular program gets support, whether that's monthly or whether it's weekly. You do have support, and that's really, really key that you have someone there that you can talk to. In fact, even if you're on the monthly program, if you're having a problem, you have a number that you can call and really get support while you're using this. So
exactly.
you have somebody that's there for you to help you, and I think that one of the things is by you're taking the approach of being safe, you're also trying to also appease all the state gods for medical licensing.
Well, exactly right. No, I mean, there are always rules to follow. So
Yeah, that's really there. Let's take a look at the next set of questions. Good Morning America recently, within the past week or so, did a piece on using GLP-1s, and they said, do not use a compounding pharmacist. How or why do you do so? And if so, and if you don't want mine compounded, do you still offer it? Your thoughts? I have some thoughts on this, Turner, but I'll let you take it first.
yeah, no, no, I mean, I've been in the compounding pharmacy world a long time, and the regulations have changed a lot for compounding pharmacies since the 2010s, and there are a lot of there's a new type of entity out there called a 503B pharmacy. And what's different about these types of pharmacies is they're actually FDA approved. FDA goes in and inspects them just like a drug manufacturer. There's only about 30 or so in the country, and these pharmacies specialize in they can only do sterile products. That's the limitation they have. So they're specialized in making these injections, which was always a challenge for the normal compounding pharmacy, for the pharmacy down the street, to do that, especially if you're doing it in a large volume of them, to do it correctly. But with these new regulations, there's a lot more confidence in the quality of the products, and we've done our due diligence as far as the pharmacies or the pharmacy that we use for the product. It's in Florida, so it doesn't have to travel across the country. Um, so as long as the quality assurance programs are there for a pharmacy, they can be safe to use. There's a lot of this going on in the country right now. It does require a little bit of more due diligence and vigilance from the provider to make sure you have a good pharmacy that you're using it from, and not just the cheapest pharmacy that you can get it from. And that's something that I think, one of the advantages I've always felt that we have when we offer these types of services is, being a pharmacist myself, I can kind of appreciate what makes a good pharmacy versus a sketchy one. And we try to make a good decision
Sure.
in that manner. But it is, unfortunately, the nature of compounding pharmacy, they aren't, the same FDA approved product as is commercially available. But at the same time, you're also able to offer that at a much lower price than the name brand product, and in this case, uh, circumvent a lot of shortage. So the FDA has a shortage list, and if these products are on a shortage list, then they are able to compound them to provide them, when the manufacturers can't. So that's all part of the bigger picture of how the compounding industry works there. But yeah, with those new regulations, it is a much safer prospect than it used to be. A lot of that, and again, the drug manufacturers do not like compounding pharmacies, obviously, because they take business away from, selling their commercial products, take market share away from them. So, you have to balance all those things with some of the information here. And at the end of the day, it's just doing your due diligence and making sure that the pharmacy is doing things the right way. And these new types of registrations and licenses kind of helps us to determine that.
Sure.
And now, as far as do we still offer it if you don't compound it? Yeah, that would, if we don't non-compounded is simply just a commercial product. So you can get those at, a prescription at CVS or Walgreens. You would be getting the same box of medication as those, name brand Ozempic or name brand Wegovy or those sorts. There is no generic available for those products commercially now. So they are still on patent and still name brand products. So they are of course available at any, if they're not on back order, not on shortage, they're available at CVS, Walgreens, and any of the other retail pharmacies out there. So
Yeah, I think one of the things to point out is that, and I'm going to compliment Good Morning America for doing this, but they're going to be working with the big pharmaceutical companies. And as you mentioned, the pharmaceutical companies really don't like compounding pharmacies. And so what they're going to do is they're going to err to the conservative side, broadcasting across America.
sure,
And I also
sure.
have to point out, I'm sorry, Turner, go ahead.
Oh yeah, no, I said sure, and it is a legitimate, safety is a legitimate issue and concern. But again, it's making sure you're using a reputable pharmacy there for sure.
Right. But I think also there's a lot of compounding pharmacists just don't have the processes and haven't been in the business as long as you have. I mean, you know what it takes to work with patients. You put together a program to provide the support. A lot of times when you walk into a CVS or a drugstore and you buy some of these things, you're not getting the support that you need. And that's where you get into trouble, where you're using maybe too much and you don't know the dosing levels, and you don't really know how to handle a lot of the side effects. The key is not just to get the actual product itself. The key is to get the support to go with it to really put together a successful program.
It makes it more effective for sure. There's no doubt about that.
Right, it's there. So let's jump into the last question that's here. We mentioned nightshade vegetables. We did not put up a graphic, and that's I apologize. We made a slide change, but let's talk about nightshade vegetables for a second. Nightshade vegetables really contain small amounts of alkaloids, which can work and cause some, let's just say, some nausea and some discomfort, constipation and things. Those are things like tomatoes, eggplants, white potatoes, not sweet potatoes, bell peppers, and different spices, the cayennes and paprikas and things like that. What you really want to do is you want to stick to highly nutritious diet supplements when you're using this particular thing. The problem is a single bell pepper may contain enough of these alkaloids to cause a problem, but some people can take them and some people can't. So again, it depends on your particular body and whether you adjust to them. We're mentioning those because we really want to err to the side where you don't have a lot of side effects. And it's something that if you can avoid using some of those when you're on the program, it'll probably lessen the chance of having any side effects. Thoughts, Turner?
No, exactly. No, I think you explained that very well.
Great. So, well, listen, we've covered a lot of subjects on semaglutide. I want to really point out, if you're going to get into this weight loss program, get support. Where I've seen, not only on YouTube, but a lot of reading and looking in the background, where people get into trouble is when they don't get support and they take too much of it and they take it too quickly. The product will work. I'm taking it and I can tell you, trust me, it works. But you really got to be cool because I think everybody gets excited about their weight loss. But if you can lose, like you mentioned, Turner, that half pound between 2 to 4 pounds a week, that's really what you want to do, is to really stay in that and not have dramatic weight loss. Thoughts, Turner?
Correct. No, that's exactly correct. And that moderate weight loss like that is much more sustainable over a longer period of time than really rapid weight loss. So
Right. Because I think the key of this program is not just to lose weight. It's just when you get off the program to have it stick. And I think part of this is not only the semaglutide itself, but also modifying your diet, getting an exercise program, and candidly feeling a lot healthier will really help you quite a bit. Exactly. So, final thoughts, Turner?
Yeah, no, I think good questions, and it's certainly been a hot topic in all over the country in the last year or so. So we're excited to be able to offer it, and and here for any future questions. Feel free to reach out.
Thank you very much for joining us tonight.
Thank you, bye.